Hey guys, this is Dr. Hub. Today we'll look at the gastrointestinal hormones, so GIT hormones, and we are focusing on the source and the actions. So the first one is the gastrin. So gastrin, what is the source of the gastrin? It is from the G cells. So the source is from the G cells and it is present in the stomach, and that is mainly the antral. Then let's look at some where it is stimulated and where it is inhibited. So in terms of the stimulation, what stimulates? It is stimulated in terms of the acid secretion as well as in terms of the mucosal growth. Next, let's look at the CCK. CCK is a very important hormone. So in terms of the CCK, it is the source being the I cells. So the source is I cells and this is of the duodenum. This is of the duodenum as well as the jejunum. This is of the duodenum as well as the jejunum. So where is it inhibited? So inhibition is taking place in case of the gastric emptying. So inhibition is taking place in the gastric emptying. And then where does it stimulate? So where does the stimulation take place? So the stimulation, if you see, it takes place in case of the pancreatic HCO3. In pancreatic HCO3, the stimulation as well as in terms of the pancreatic enzymes. So pancreatic HCO3, pancreatic enzymes as well as the gallbladder contraction. Gallbladder contraction. Then also in terms of the exocrine pancreas growth. So all the pancreas has a pancreatic HCO3, the pancreatic enzymes as well as the pancreatic exocrine growth. So all these conditions, it is increasing. That is, it is stimulates. Next we look at the secretin. The secretin is from the S for secretin, S for the S cells. So secretin is from the S cells and it is deep in the mucosa. So it lies deep in the mucosa. And this is of the upper small intestine. This is of the upper small intestine. And next we look at where it is S. S is nothing but the stimulation. So where is it stimulated? Before stimulated, let's look at the inhibition. So where is it inhibited? So it inhibited in the acid secretion. So this is a secretin. In terms of acid secretion, inhibited, and it's stimulated in terms of the pancreatic HCO3. There is a pancreatic HCO3. Then comes the biliary HCO3. So this pancreatic HCO3 as well as a biliary HCO3, and then comes the exocrine pancreatic growth as well. So pancreatic HCO3, the biliary HCO3 as well as the exocrine pancreatic growth. Next we move on to the GIP. So in terms of the GIP, where is it inhibited? GIP is inhibited in case of the acid secretion. So the GIP is inhibited in case of the acid secretion. And where is the insulin? Where is it stimulated? The stimulation takes place in case of the insulin release. Next is we look at the motilin. M for motilin. So it is for, it also starts with M. So it is from the Mohs cells. It is from the Mohs cells, and this is taking place in the duodenum as well as the jejunum. So what are the things involved here? So it is stimulated in case of the gastric motility and the intestinal motility. So in terms of the gastric motility as well as the intestinal motility.